Welcome back everybody. Today we will discuss about a case of a 30-year man presented with a mediastinal swelling, a mediastinal tumor. This is a case of a mediastinal tumor, anterior mediastinal tumor having various components. So on scanner view we can appreciate that there are many kinds of tissue. Like here we can appreciate these are some acini like structures, some glandular structures. So these are some glandular structure mimicking pancreatic acini. So these are mimicking pancreatic acini. And there is a large cystic area also containing this amorphous eosinophilic material. Here we can appreciate this lining having this cilia. So we can appreciate this cilia. So probably this is an epithelium mimicking respiratory epithelium. So we can appreciate this kind of respiratory like epithelium. So we can appreciate it. We can appreciate nice cilia here. Then we can appreciate this mucinous kind of gland. So mucinous glands are there. Actually seromucinous, both kinds of glands are there. Here we can appreciate both serous, like these glands are serous glands, these glands are serous glands, and these are mucinous gland. So seromucinous, especially we can appreciate here ciliated epithelium. So seromucinous gland along with ciliated epithelium. Here we can appreciate that there are these stratified squamous epithelium. Stratified squamous epithelium is there. Here this stratified squamous epithelium. Here we can appreciate this pilosebaceous, specially sebaceous unit. So if we magnify, here we can appreciate this sebaceous unit, sebaceous glands along with this stratified squamous epithelium, this stratified squamous epithelium. So probably surface ectoderm, which is originating, this component is originating from surface ectoderm. So we have seen this seromucinous gland along with respiratory epithelium, especially this pancreatic kind of tissue, pancreatic tissue. Then we can appreciate these fatty areas like these adipocytic areas with this smooth muscle and this collagenous area, collagen bundles along with this adipocytic areas with this smooth muscle component and these proper lumen like structures lined by mucinous epithelium. So this lumen like structure and then smooth muscle is also there. So here we can appreciate that there are cartilage also. So this is a mesodermal origin, cartilage is there, this part is cartilage, this adipocyte is there which is also mesoderm, then ectoderm. So mostly here there is surface ectoderm and endodermal in origin, that these goblet cells and respiratory epithelium, these are endodermal origin. So we can appreciate three kinds of ectodermal, endodermal and mesodermal origin components are there. Next slide, we can appreciate these pancreatic tissue more nicely. Here the glandular component, like the ductular system, with these small mucin secreting gland like structures. Here proper intestinal mucosa is there, so we have appreciated this intestinal mucosa also. Then here is a bit of cartilage again. Here there is nice this pilosebaceous or appendigeal unit is there, along which is continuum with this stratified squamous epithelium. Then here we can appreciate these lymphoid aggregates. So this may be the adjacent thymus or the remnant of thymus, which is situated also in anterior mediastinum. So again we can appreciate here the different components like these mucin secreting cells with this respiratory like epithelium, with this stratified squamous epithelium. Here we can appreciate this keratin cyst, this pilosebaceous unit, beautiful stratified squamous epithelium, which is also continuous with this pilosebaceous unit, this keratin debris. So there is an island of this ectodermal component, it is there. The last section we can appreciate the adjacent structures like the intercostal muscles, fats, so these are not a part of the tumor. And here there are few bony bits. Here we can appreciate these bony bits or bony chips. So these are not a part of the tumor, but they are the local tissue. So we have 3 component, although it may have less than 3 like 2 or monodermal component, means single dermal origin component, but in this case we have proper 3 component along with no immature neuroectodermal component. So this is a case of a mature teratoma in a middle-aged man. In this scenario we can sign out this case as a cystic mature teratoma. description with all three components of of ectodermal, like surface ectodermal, endodermal and mesodermal components. Thank you.